Assalamualaikum warahmatullahi wabarakatuh. May you be in the blessings of Allah SWT. Welcome to my YouTube channel. I am Brother Rizwan, the Ruqyologist. Alhamdulillah, Shawwal has come towards the end, and we have did our visiting, our asking for forgiveness, giving alms to the kids, and building relationships, rekindling relationships with our relatives and friends. Alhamdulillah for such blessment. And Alhamdulillah, during this month also I had the opportunity to help address, clarify, share the healing journey with a lot of you guys, my followers, or some of you will be recommended by others. Alhamdulillah, thank you very much. Okay, for today, Alhamdulillah, I have one of my clients who has adopted my intensive Ruqya therapy, and she has agreed to be interviewed just for a short while to share her experience in Ruqya for her condition. So the interview will be conducted in Malay, as she is an elderly lady. However, for those who do not know Malay language, you can skip towards the end of the video where I'll try to briefly summarize what she said in English, inshallah. So let's listen to the interview.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, Alhamdulillah, hari ni malam ni saya ada seorang klien saya, makcik. Nama saya tak akan dedahkan lah. Okay. So Alhamdulillah, kita baru saja habis meruqyah. Ruqyah makcik ni saya dah ruqyahkan berapa kali lah dengan proses intensif ruqyah terapi. Makcik sebenarnya ada diagnose dengan kanser lah. Jadi malam ni insyaAllah kita ada sikit perkongsian dengan makcik supaya untuk memberi motivasi lah untuk sesiapa yang mungkin dalam situasi yang sama, yang kita boleh belajar sedikit sebanyak lah daripada pengalaman makcik. Assalamualaikum makcik.
Waalaikumsalam.
Okay, makcik, mungkin kita nak kenalkan makcik sedikit je kepada pendengar. Umur makcik berapa agak anggaran?
Umurnya 61.
Masya Allah, 61. Alhamdulillah. Okey, jadi bila kali pertama makcik dapat tahu yang makcik dapat kanser?
Dalam bulan 2.
Bulan Februari ni.
Dalam bulan 2 pergi hospital sebab sakit pinggang, tapi sampai hospital diorang cek darah terlalu kurang.
Darah terlalu kurang.
Diorang suspek kanser myeloma.
Okey, multiple myeloma cancer kalau ni. Okey. Kemudian apa yang terjadi selepas itu? Doktor sarankan apa?
Doktor buat macam-macam pemeriksaan, buat scanning, CT scan apa semua. Lepas diorang suruh cek bone marrow. Daripada bone marrow tu dapat tahu yang diorang confirm saya makcik ada kanser.
Kanser ni lah.
Terus diorang suruh treatment kemoterapi. So far makcik pergi tak? Tak pergi langsung.
Tak pergi langsung. Okey. Sebelum saya nak tanya tu kenapa makcik tak pergi, saya nak tahu disebabkan multiple myeloma cancer ni, ataupun untuk mungkin ada pendengar atau yang tidak tahu apa tu, dia adalah kanser kepada darah, pendarahan. Betul kanser ada macam-macam ada terlampau banyak lah, there's a lot of cancer, the different types. Multiple myeloma cancer selalunya adalah kanser pendarahan. Apakah akibat kanser ni kepada badan makcik? Apa yang makcik rasa? Sakit ke apa ke?
Tulang lah, mostly dia attack tulang kita. Jadi kita tak kuat.
Tulang, tulang maksudnya satu badan ke? Macam mana?
Mana yang ada injury tu, itulah paling teruk.
Okay. Untuk makcik mana selalu sakit?
Pinggang.
Pinggang belakang sinilah. Okay. Memang tu banyaklah, ramai orang akan ada sakit pinggang belakang tu sebab kanser myeloma ni. Okay. Jadi doktor sarankan pergi kemo lah dengan segera kan waktu itu kan. Tapi makcik dengan anak makcik memilih untuk pergi ruqyah.
Betul.
Apa yang buat makcik dengan anak makcik tu sebenarnya nak cuba ruqyah? Pasal selalu orang ruqyah, klien saya lain ruqyah tu pengakhiran. Tapi makcik dengan anak makcik terbalik. Yang pertama sekali makcik cari adalah ruqyah. Kenapa je?
waktu doktor explain kan pasal kemoterapi, dia ada juga explain pasal side effect apa semua. Habis dalam keadaan cik punya badan nak kena gain weight, nak kena naikkan berat badan dulu baru boleh stable. Habis bila doktor dah cakap side effectnya itu ini, habis keluar daripada hospital pun macam-macam orang cakap itu ini. Jadi anak saya dia cakap kita balik daripada hospital, kita cuba alternatif lain dulu.
Okey. Jadi Encik bimbang dengan kesan sampingan lah, side effect daripada perubatan kemoterapi lah. Memang kemoterapi tu lazim ni kita tahu dia kuat lah, dia memusnahkan sel-sel kanser. Cuma dia terlampau kuat, kadang-kadang dia memusnahkan jugalah ataupun ada kesan sampingan lah pada organ-organ lain ni dalam tubuh. Wallahu a'lam bishawab. Yang ada orang okey saja yang ada orang mungkin badan dia tak boleh tahan. Wallahu a'lam.
Faktor umur pun
ya betul. Ada orang tak boleh doktor pun tak kasih buat kemo sebab ada faktor-faktor lain lah. Okey, jadi lepas tu makcik balik dan anak makcik lah ke makcik yang nak buat ruqyah sebenarnya?
Saya bincang dengan anak makcik.
Okey.
Jadi itu yang dia ada kontak, dia terus kontak.
Waktu makcik nak meruqyah tu, makcik memang dah rasa yakin ke? Setengah-setengah ke macam mana? Pasal ni satu benda yang tak ramai orang
cik yakin. Pasal apa? Doktor cakap multiple myeloma ni tak ada kesembuhan. So treatment dia akan berterusan. Tapi dalam Al-Quran kan dah cakap kan tiada penyakit yang tiada obat melainkan mati. Jadi saya pegang pada Al-Quran. Masya-Allah,
alhamdulillah. Jadi makcik dah yakin lah semua sebelum pergi ruqyah tu.
Sama ada ustaz lagi yakin lah.
Yalah, sama ada ruqyah tu efek ketat tu itu belakang cerita, tapi makcik dah yakin yang dengan mujizat Quran daripada Allah SWT tu boleh dapatlah kesembuhan, sama ada Allah nak berikan tidak. Okay, masya-Allah, alhamdulillah. Okay. Jadi kita yang pertama kali kita ruqyah sekali saja waktu tu. Kemudian makcik balik, saya balik, kemudian makcik ada memuntahkan muntah darah, darah beku. Wallahu alam tak tahu apa tu cik.
Sebelum tu ada hidung berdarah tak berhenti-berhenti kan.
Ya, saya ingat. Tu makcik beritahu saya kan, hidung berdarah. Kita nak mulakan ruqyah, hidung makcik keluar darah. Dan makcik cakap ini biar dah selalu berlaku kan. Kemudian saya ruqyahkan sekali, pegang tot dan bacakan ayat Quran. Lepas tu berdarah lagi cik.
Time tu dah stop.
Dah berhenti. Alhamdulillah. Jadi kalau berlaku boleh sajalah lakukan tu. So far pernah berlaku lagi tak?
Tak ada.
Dah tak ada lagi lah. Satu kali je.
Ada sekali. Tapi saya ikut apa yang ustaz ajar.
Okay, masya-Allah. Jadi makcik pun dah tahu. Okey. Kemudian ada muntahkan benda darah beku tu, wallahu alam tak tahu apa. Jadi walaupun nampak macam ngeri, tapi dia memberi makcik keyakinan yang ayat Quran tu memberi kesembuhan. Jadi penyakit tu keluar, kita tak tahu benda. Okay. Tapi kemudian kita memulakan terapi intensif lah ruqyah tu. Waktu tu makcik sakit belakang dan sebagainya kan. Contoh untuk hari ni makcik sakit apa, belakang, sakit perut kan. And macam mana dengan sakit-sakit tu semua makcik bila lepas ruqyah?
Lepas ruqyah dah tak ada rasa sakit.
Hilang semua?
Hilang.
Masya-Allah, alhamdulillah. Semua dengan kuasa Allah lah kan. Makcik mungkin tak dapat bezakan sebab apa? Makcik tak pergi kemo pun. Yang ada klien dia dah pergi kemo, dah pergi radio, dah pergi kemo, mungkin dia dapat perbezaan dia. Dia cakap, kemo dengan radio sakit dia masih ada ataupun kurang sedikit. Tapi lepas ruqyah jadi kosong. Untuk makcik terus tak pergi kemo, tak pergi radio, terus ruqyah terus. Jadi alhamdulillah lah makcik rasa sakit dia dah pergi. Cuma makcik tak dapat bezakan dengan perubatan medikal lah. Tapi pun kesembuhan dia makcik meraih juga kan. Masya-Allah, alhamdulillah. Okay, cuma kita nak tahu saya sakit belakang tu hilang, sakit perut tu semua hilang.
Sakit perut, sakit yang dekat
sakit
tangan.
Sakit apa lagi hilang?
Sakit yang dekat tangan.
Sakit tangan tu sakit apa?
Tendinitis semua hilang.
Tendinitis tu apa yang menyebab efek dia? Tangan makcik tak boleh tutup ke apa?
Tak boleh nak tutup.
Tak boleh
nak genggam.
Tak boleh. Tu makcik tak bilang saya kan?
Tak.
Jadi lepas ruqyah tahu boleh genggam.
Boleh genggam.
Jadi tendinitis tu hilang.
Boleh buka besar lagi jari.
Dulu tak boleh.
Dulu tak boleh.
Berapa lama dah ada tendinitis ni?
Itu dah lama. Tu waktu kerja. Pasal kerja banyak pakai jari jemari kan.
Kira maksudnya dah lama apa? 5 tahun ke? 3 tahun ke?
Ada dalam 5 tahun.
5 tahun tendinitis ni lah. Tahu-tahu dengan ruqyah hilang.
Terus hilang.
Okay, Alhamdulillah. Kadang-kadang Allah beri rezeki, kita minta ini macam banyak, Allah beli lebih lagi. Keyakinan makcik kan, saya pun tak tersangka lah. So ada juga klien-klien ni juga yang meraih lebih daripada apa yang diminta kepada Allah. Semua rezeki daripada Allah SWT. Hari ni kita dah lihat tadilah makcik susah nak bangun, beberapa lah penyakit, kaki rasa berat nak jalan. Sekarang dah rasa okey?
Sekarang dah okey. Bahu yang pun dah lama sakit pun dah tak ada dah terus.
Alhamdulillah. Bahu, perut, belakang, kaki dan sebagainya. Jadi setelah proses intensif ruqyah ni makcik dah melalui kan, apa pandangan makcik tentang ruqyah untuk penyakit, untuk konteks kita ni, konteks kanser lah mungkin sebagai pesakit kanser. Makcik rasa, apa pandangan makcik? Macam orang mesti cakap, makcik ni betul sakit tak pergi kemo, pergi jumpa perawat pula.
Pada makcik, keyakinan tu perlulah. Keyakinan, kalau kita dah buat keputusan yang kita nak buat itu, kita kena yakin. Lagipun melalui Al-Quran, katakan Allah nak bohong kita. Semua ubat ada dalam Al-Quran.
Masya-Allah. Alhamdulillah. Okay. Alhamdulillah. Dan kalau ada apa ni namanya, pesakit-pesakit lain yang mungkin pun ada mengalami penyakit, berbagai penyakit lah, contoh kalau ada yang sakit kanser ke, mungkin berbolak-bolak hati nak pergi ke tak kan, apa mungkin nasihat makcik lah sebagai seorang yang telah ada sakit kanser dan masih berjuang dan telah melakukan proses ruqyah ni lah.
Pada cik, kalau kita tak ada keyakinan, kita ikut ustaz punya terapi lah, nanti akan dengan sendirinya kita ada keyakinan.
Oh, masya-Allah, alhamdulillah. Jadi maksud makcik tu melalui proses saya ni, kalau siapa kurang keyakinan dia tu, saya mungkin dapat membinakanlah kekuatan keyakinan tu.
Kadang-kadang ada benda-benda yang dah lama kita simpan, pendam kita tak tahu, kita lupa. Tapi melalui terapi ni semua akan keluar balik.
Mungkin masya-Allah, semua dengan izin Allah.
Satu pembersihan juga.
Yalah, tazkiyah itu pembersihan betul, masya-Allah. Alhamdulillah. Okey, itu yang terbaik sangat. Kita terus berjihadlah. Jadi tapi apa pun kita makcik redha lah apa yang Allah turunkan kepada kita, sama ada kita dapat kesembuhan ke tak, seperti makcik cakap, itu semua daripada Allah. Kalau Allah beri lebih lagi, alhamdulillah. Dan kita terus tidak putus asa. Alhamdulillah.
Berdoa lah.
Alhamdulillah. Betul.
Pada dia.
Alhamdulillah. Makcik telah meletak Quran, ayat-ayat Allah tu di tempat yang sesuai, iaitu di makamnya, iaitu yang makam tertinggi. Alhamdulillah. Jadi kita semua berdoa untuk makcik supaya sentiasa makcik dan keluarga dilindungi Allah, diberi syifa dan rahmat, kesembuhan yang sempurnanya untuk seluruh keluarga, dan juga semoga perkongsian makcik ini memberi manfaat kepada umat-umat kita yang lain, dan jika mereka mendapat manfaat melalui perkongsian makcik, insya-Allah Allah juga akan memberi ganjaran kepada makcik dan sekeluarga.
Cubalah, kalau tak cuba tak tahu kan.
Allah betul. Allah alam bisawab. Okey, terima kasih makcik. Assalamualaikum.
Waalaikumsalam.
Bangun pelan-pelan cik, tengok macam mana. Bismillah. Sakit? Kalau bangun gini sakit? Sakit sikit Okey, pelan-pelan duduk. Bismillah. Jadi kalau bangun dari baring lagi teruk lah. Bismillah. Pelan cik, boleh bangun, cuba tengok beza dia. Cuba jalan sikit. Okey, rasa okey? Okay, Alhamdulillah, welcome back. Okay, for those of you who were not able to understand the interview in Malay language, pardon me. I'll try to briefly summarize this case study. Okay, basically, this client of mine, this lady, she's in early 60s. She's 61, I think. Yes. She suffered sometime early this year, or maybe 2 months ago, some pain to her body, specifically her lower back. So of course went to the hospital to make a check, and the doctor initially suspected blood cancer or cancer. Immediately on the same day, she and her daughter had a discussion and messaged me while they were still in the hospital, asked me if they should proceed with Ruqya. With very little information, I just advised them that we can make the effort through Ruqya. There is no issue, there's no harm in it, right? In fact, there is much to gain. So Alhamdulillah, she got herself discharged. And that same night, I went to perform Ruqya on this lady, and there were some improvements. In fact, at the end of the session, just after I left, she vomited some pile of blood clot perhaps. It was quite a big amount of blood clot. So this strengthens her belief that the Quran heals. So she have to meet with the doctor again for more checks. So more scans were done, more checks were done, and the doctor finally confirmed by their tests that this lady was experiencing or suffering from multiple myeloma cancer. For those who do not know, this is actually the cancer of the blood. There are many different types of cancer: colon cancer, cervix cancer, too many that I do not know of, in fact. But this lady is suffering from myeloma multiple cancer. It will usually also cause, it may cause pain to the lower back at the tailbone area there, and some bleeding to the nose. So in fact, that was what happened to this lady. She had the symptoms that she felt was bleeding on her nose randomly. It would just flow out, and then she have lower back pain, which causes a lot of issues because she will not be able to get up from her bed or lying down position. She's not able to get up from a sitting down position easily. It will be with so much difficulties. She have to really be cautious and take a lot of care because it will hurt her when if she do it abruptly. Yes, so once they had confirmed it, this lady and her daughter called me and said that they want to proceed with the intensive Ruqya therapy, and they have decided not to proceed with the doctor's recommendation, which is to straight away perform chemotherapy. So this lady, because due to her age factor, she does not want to take the risk of going through chemo yet, because due to the side effects, according to her, she did not want to take that risk first. So Ruqya has no adverse risk in such manner. So, and she believes strongly, even before attending to my therapy session, she believes strongly that Ruqya, through the words of Allah, the Quran, is able to cure. And she quoted the verse saying that there is no sickness that has no cure except death, somewhere along that line. So she believed, and she held on to that words, and thus we proceeded with the Ruqya. So we had 3 appointments or 3 meetings, Alhamdulillah. From the first meeting, actually, we had witnessed significant progress. A lot of her pain was gone. Remember I was saying that they have bleeding to the nose. Even when as I started the Ruqya, straight away blood trickled down her nose. So yeah, we wiped it and I performed Ruqya on the nose first, and it stopped bleeding since. And I taught her how to do it, and she said it occurred once again. That's all, and she did what I told her to do. And then her back pain was gone. She was I shared a video, like a short video in our last therapy, how she was, the trouble she had when getting up from her sitting down position, how she had to wear that brace support belting to prevent to minimize movement, so that she does not feel the pain. In fact, during the Ruqya, she felt there was some pain, or this, she said, this like this hard marble-like feeling somewhere in her stomach area. So when I concentrated and focused to Ruqya on those places, she started to cough. So the issue was this coughing caused her back to hurt even more. So I decided to focus on her back first, and Alhamdulillah, her back pain was gone. Then once it was gone, it was easier for me to proceed on to perform Ruqya and attack the pain at the stomach area. And once that was addressed too, we proceeded with other pains. So then she was able to get up, but she was not able to walk properly at first. So I asked her what was the issue. She said her legs felt kind of heavy and pain, and then we addressed that too. Alhamdulillah, she can walk easily after that, no pain, no heaviness. And before this, she said she had problem with strength. That means she's not even able to carry a bottle of water. She finds it very heavy. So after the Ruqya, no issues, Alhamdulillah. Was there anything else? Yeah, there were a few other issues. Oh yeah, she shared before, during our second session, after the Ruqya, she shared with me suddenly, like she was in awe, because she didn't tell me that she had tendinitis. So after the Ruqya, she said it's gone. Then I asked her what is gone. She said, and then she started clenching hands and said, I had tendinitis for a few years, so this is where it affects the nerves, and she's not able to close her hands properly or fully, and neither can she open wide fully. So after the Ruqya, it was working as normal. Alhamdulillah, Allah gave her more than what she asked for. That is when we have full reliance in Allah, and there are certain things that we need to address when we do IRT, intensive Ruqya therapy, which I'll try to guide. And whatever we receive from Allah, that is up to Allah's decree. So for this lady, Alhamdulillah, she has experience, she believed, and she enjoyed the whatever Allah has bestowed upon her. And even if Allah did not choose to not bestow her with this health progress, I'm very sure this lady, she will accept it with willingness. I can see that rida in her contentment, mashallah. So Alhamdulillah, with her sharing, we hope that more people will consider Ruqya, and not exactly as an alternative treatment, but as the treatment. Here, as a Ruqyologist, I do not refute medical treatment. Please carry on with whatever medical treatment. The knowledge, the ilm in medical world is also granted by Allah SWT. We can't possibly come up on our own, right? So there is benefits in it too, inshallah. So, but the problem with our society is we tend to forget that there is another form of treatment which should supersede everything else, which is the treatment of Allah, the Quran, direct treatment from the Creator Himself, the one who tested you with these conditions, these diseases, and the one who can alleviate all these diseases. So Alhamdulillah. So I hope that you have benefited from this interview with this lady. And if you have any problems, any issues, any questions, you may drop me a WhatsApp perhaps. If you want to comment, you can comment. Inshallah, I will check and reply. Yeah, so perhaps in the future we can interview more of such of my clients, with the intention to motivate others. We need to give each other encouragement as ummah, tell each other that hey, it's okay, I've been through it, and you can do it, if I can do it, you can do it, inshallah. Allah is there for you. So yeah, we help each other, inshallah. With that, I see you again. Assalamualaikum warahmatullahi wabarakatuh.